Sickle cell anemia. Human body produces normal red blood cells that are flexible and round and can easily move through the blood vessels. In sickle cell anemia, the red blood cells become rigid and sticky. They take the shape of sickles or crescent the moon. Irregular shaped cells. It is an inherited form of anemia. It is a condition in which there is no healthy blood cells to carry oxygen throughout the body. These irregularly shaped cells get stuck in small blood vessels which slow down or inhibit the flow of blood and oxygen to other parts of the body. Life of RBC and sickle cell. Red blood cells live for 120 days before the body needs it to be replaced, but sickle cells usually die within 10 to 20 days, causing a red blood cell deficiency that leads to anemia. Sickle cell anemia is a hereditary disease that is transmitted by genes from parents to their children. It is not contagious and cannot be picked up by a person to another. Sickle cell anemia is a severe hereditary form of anemia in which a mutated form of hemoglobin distorts the red blood cells into a crescent shape at low oxygen levels. Point mutation in sickle cell anemia. Sickle cell anemia is a disorder caused by the smallest of genetic changes. The alteration of a single nucleotide in the gene for the beta chain of the hemoglobin protein, that is, the oxygen carrying protein that makes blood red, is all it takes to turn a normal hemoglobin gene into a sickle cell hemoglobin gene. This single nucleotide change alters only one amino acid in the protein chain, but the results are devastating. Beta hemoglobin is a single chain of 147 amino acids. In sickle cell anemia, the gene for beta globin is mutated. The resulting protein still consists of 147 amino acids, but because of the single base mutation, the sixth amino acid in the chain is valine rather than glutamic acid. Main types of sickle cell disease. Hemoglobin SS disease. Hemoglobin SS disease is the most common and most severe type of sickle cell disorder. It occurs when the hemoglobin S gene mutation from both parents are inherited. In this type, the body produces only hemoglobin S. This type is often called sickle cell anemia. Hemoglobin S beta 0 thalassemia. Hemoglobin S beta 0 thalassemia occurs when the hemoglobin beta S gene from one parent and a hemoglobin beta 0 thalassemia gene mutation from other parent are inherited. It has similar symptoms to hemoglobin SS disease and is also called sickle cell anemia because the body only produces hemoglobin S. Hemoglobin SC disease. Hemoglobin SC disease is the second most common type of sickle cell disease. It occurs when the hemoglobin beta S gene from one parent and the hemoglobin C gene from the other parent are inherited. Individuals with hemoglobin SC disease may have similar symptoms to individuals with hemoglobin SS disease. The symptoms may be less severe. Hemoglobin S beta thalassemia. Hemoglobin S beta thalassemia occurs when the hemoglobin beta S gene from one parent and a hemoglobin beta thalassemia gene from the other parent are inherited. Some normal beta hemoglobin is produced but in reduced amounts. Because the body produces some normal hemoglobin, this form of sickle cell disease is less severe than hemoglobin SS disease. Symptoms are usually milder than hemoglobin SS or SC disease. hemoglobin SD, hemoglobin SE and hemoglobin SO. These type of sickle cell diseases are less common and are usually less severe. Causes of sickle cell disease. The cause is inheritance. It is a change in the genes which tells the body how to make an important protein called hemoglobin. In sickle cell anemia, they have two altered hemoglobin genes, one from each parent. If there is only one gene, it is called sickle cell trait, which is very much milder. What is a sickle cell trait? Sickle cell trait is not a disease, but having it means that a person is inherited with sickle cell genes from one of his or her parents. People with sickle cell trait do not have any of the symptoms of sickle cell anemia and live a normal life. What makes the red blood cells sickle shaped? In sickle cell disease, low oxygen causes red blood cells sickling and damages the cell membrane and decreases the cell's elasticity. The rigid red blood cells are unable to deform as they pass through narrow capillaries, leading to vessel occlusion and ischemia. The actual anemia of this illness is caused by hemolysis, the destruction of red cells inside the spleen. What happens to the sickle cells? The sickle cells containing mostly HBS are harder and less flexible than normal red blood cells. So, they can get stuck in the small blood vessels and block them. This can happen quite suddenly, causing various symptoms which are known as sickle cell crisis. Repeated blockages can also lead to complications. The sickle cells are destroyed more easily than normal red blood cells, and this means that people with SCD tend to be short of red blood cells and have moderate and persistent anemia. Diagnosis. A blood test checks for the defective form of hemoglobin that underlies sickle cell anemia. In the United States, this blood test is a part of routine newborn screening, but older children and adults can be tested too. The blood sample is analyzed to see what type of hemoglobin is present in the blood using a test called hemoglobin electrophoresis. In many countries, there is a screening program to test the pregnant women and newborn babies for sickle cell disease and other hemoglobin disorders. For the expectant parents with a history of sickle cell disease, a test for the disorder may be performed before birth using a small sample of amniotic fluid, the liquid that surrounds the unborn baby or the placenta. These prenatal tests screen for the mutated HBB gene rather than abnormal hemoglobin protein. Symptoms. Signs and symptoms of sickle cell anemia usually appear around 5 months of age. They vary from person to person and change over time. Anemia. Sickle cells break apart easily and die, leaving the affected person with too few red blood cells. Red blood cells usually live for about 120 days before they need to be replaced. But sickle cells usually die in 10 to 20 days, leaving a shortage of red blood cells leading to anemia. Without enough red blood cells, the body cannot get enough oxygen, causing fatigue. Episodes of pain. Periodic episodes of pain, called pain crisis, are a major symptom of sickle cell anemia. Pain develops when sickle-shaped red blood cells block blood flow through tiny blood vessels to the chest, abdomen and joints. Pain can also occur in the bones. The pain varies in intensity and can last for a few hours to a few weeks. Some people may have only a few pain crises a year, whereas others may have a dozen or more pain crises a year. A severe pain crisis requires a hospital stay. Some adolescents and adults with sickle cell anemia also have chronic pain, which can result from bone and joint damage, ulcers, and other causes. Swelling of hands and feet. The swelling is caused by sickle-shaped red blood cells blocking blood flow to the hands and feet. Frequent infections. Sickle cells can damage the spleen, leaving the person more vulnerable to infections. Doctors commonly give infants and children with sickle cell anemia vaccinations and antibiotics to prevent potentially life-threatening infections such as pneumonia. Delayed growth or puberty. Red blood cells provide the human body with oxygen and other nutrients needed for growth. A shortage of healthy red blood cells can slow growth in infants and children and delay puberty in teenagers. Vision problems. Tiny blood vessels that supply blood to the eyes can become plugged with sickle cells. This can damage the retina, the portion of the eye that processes visual images, and lead to vision problems. Complications. Sickle cell anemia can lead to a lot of complications. Stroke. Sickle cells can block blood flow to an area of the brain. Signs of stroke include seizures, weakness or numbness of arms and legs, sudden speech difficulties, and loss of consciousness. If a child has any of these signs or symptoms, seek medical treatment immediately. A stroke can be fatal. Acute chest syndrome. A lung infection or sickle cells blocking blood vessels in lungs can cause this life-threatening complication, resulting in chest pain, fever, and difficulty in breathing. It might require emergency medical treatment. Pulmonary hypertension. People with sickle cell anemia can develop high blood pressure in their lungs. This complication usually affects adults. Shortness of breath and fatigue are common symptoms of this condition, which can be fatal. Organ damage. Sickle cells that block blood flow to organs deprive the organs of blood and oxygen. In sickle cell anemia, blood is also chronically low in oxygen. This lack of oxygen-rich blood can damage nerves and organs, including kidneys, liver, and spleen, and can also be fatal. Blindness. Sickle cells can block tiny blood vessels that supply blood to the eyes. Over a period of time, this can damage the eye and lead to blindness. Leg ulcers. Sickle cell anemia can cause open sores on the legs. Gallstones. The breakdown of red blood cells produces a substance called bilirubin. A high level of bilirubin in the blood can lead to gallstones. Pregnancy complications. Sickle cell anemia can increase the risk of high blood pressure and blood clots during pregnancy. It can also increase the risk of miscarriage, premature birth, and having low birth weight babies. Treatment. Management of sickle cell anemia is usually aimed at avoiding pain episodes, relieving symptoms, and preventing complications. Treatments might include medications and blood transfusions. For some children and teenagers, a stem cell transplant might cure the disease. Medications. Hydroxyurea. Daily hydroxyurea reduces the frequency of painful crises and might reduce the need for blood transfusions and hospitalizations. It can also increase the risk of infections. Do not take the drug if pregnant. L-glutamine oral powder. The Food and Drug Administration (FDA) has recently approved this drug for treatment of sickle cell anemia. It helps in reducing the frequency of pain crisis. Crizanlizumab. The FDA has recently approved this drug for treatment of sickle cell anemia. Given through a vein, it helps reduce the frequency of pain crisis. Side effects can include nausea, joint pain, back pain and fever. Voxelotor. The FDA has recently approved this oral drug to improve anemia in people with sickle cell disease. Side effects can include headache, nausea, diarrhea, fatigue, rash and fever. Blood transfusions. In a red blood cell transfusion, red blood cells are removed from a supply of donated blood and are given through a vein to a person with sickle cell anemia. This increases the number of normal red blood cells, which helps reduce symptoms and complications. Risks include an immune response to the donor blood, which can make it hard to find future donors, infection, and excess iron buildups in the body. Because excess iron can damage the heart, liver, and other organs, if one undergoes regular transfusions, they might need treatment to reduce the iron levels. Stem cell transplant, also known as bone marrow transplant. This procedure involves replacing bone marrow affected by sickle cell anemia with a healthy bone marrow from a donor. The procedure usually uses a matched donor, such as a sibling who doesn't have sickle cell anemia. Because of the risks associated with a bone marrow transplant, the procedure is recommended only for people, usually children, who have significant symptoms and complications of sickle cell anemia. The procedure requires a long hospital stay. After the transplant, one will receive drugs to help prevent rejection of the donated stem cells. Even so, the body might reject the transplant, leading to life-threatening complications. Preventing infections. Children with sickle cell anemia might receive penicillin between the ages of about 2 months old until at least the age of 5. Doing so helps prevent infections such as pneumonia, which can be life-threatening to children with sickle cell anemia. Adults who have sickle cell anemia may need to take penicillin throughout their lives if they have had pneumonia or underwent surgery to remove the spleen. Childhood vaccinations are important for preventing disease in all children. They are even more important for children with sickle cell anemia because their infections can be severe.